Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Great lady that we're all going to fall in love with, Wafaa from Louisiana via Lebanon, right?
Yes.
And you said your family came here?
Yes, a long time ago, in the 70s.
And then you've had quite a journey. Like, you have 3 children,
yes.
Very active, and all of a sudden, like, your health...
Out of nowhere.
Yeah.
Just woke up one day with neck pain, dizziness, like all the symptoms, heart rates, like, increasing, and yeah, it just like blurry vision, off balance, yeah. So
like no idea, all of a sudden, bam.
All of a sudden, no injuries.
Like 2 years ago, or how long ago?
It's been 2 years, yes.
Okay.
Since March of 2020.
And it's a windy road to end up here, right?
Yes.
So what kind of doctors did you see, and what symptom? You said the heart rate in the middle of the night, that was really scary, like the high heart rate.
Yeah, so I've seen, over like 10 doctors, to be honest, cardiologists, like I did physical therapy, I like did dry needling, like all that, kind of stuff, and nothing worked until I started to do my own research, and then I stumbled upon you on YouTube.
Why don't you talk about the main symptoms why you came? Like there was...
Yes, the main symptoms were blurry vision. I couldn't see right. I would have to like shake my eyes just to read off the phone or off a newspaper. And the heart rate was the scariest one. I would be sleeping, like deep sleep in the middle of the night at 3 a.m. Something wakes me up and just like I can't breathe, and I look at my heart rate, it's like 130, 140.
It's normally like 70?
Yeah, 70, yeah. Even when you sleep, it should be lower too. It should be in the 60s,
Did you ever go to the emergency room?
Oh yeah, I went to like 3-4 times, because of this, because I thought I was having a heart attack.
By the time you went there, was your heart rate then fine, or you actually had the tachycardia or high heart rate when you went to the ER?
Oh no, it was like fine, because it would come for like, it would stay for like few minutes, and then I would like try to like breathe in and just like calm myself down. But then one time, I went to the emergency room and it was 120, 125. They did the ECG, I don't know what's it called, the test, and they said I'm fine, and then I just have anxiety, and then I should have to calm down, and I'm like, I've never, like, they were like, you're stressing too much. I'm like, I'm not stressing, like, I have a good life, like I'm not stressing about anything. So they prescribed me anxiety pills. They put me on anxiety medication.
So in regard to your blurry vision, was it there all the time or just intermittent, the blurry vision?
Oh, the blurry vision, it was worse in the morning. Worse in the morning. Like I could not look at my phone or TV or nothing. But sometimes when I'm sitting in the, like during the day, I would like look outside and, and then I just have to like shake it off. Like, it would come like, just like shake it off. But I haven't had that since I started the treatment,
Did you ever see double vision?
No, just blurry. Blurry vision,
Okay. And then when did you start to believe that it might be a neck issue causing the blurry vision and the high heart rate? Was it just when you saw the YouTube videos?
Your videos.
Prior to seeing the YouTube videos, did you think that it might be a neck problem causing it?
No, I thought it was because my family has like, have heart disease, so it runs in the family. So I went to cardiologist right away. I did all the testing. But he thought the heart was good. Yeah, he said like I'm perfect. So that's when I started to dig into like research. I'm like, this is like not normal. Like I'm not stressed. It's not anxiety. Like I've never had that in my life. So I stumbled upon your videos, and then I heard you in one video you were talking about it, like the heart rate and stuff. So I started to connect dots together. I was like, I have to go see Dr. Hauser because he might be... Did
you get chiropractic care prior to seeing us?
I'm working with Dr. Brian Hutchison, to be honest, so I'm really doing well with him as well, because the technique, the dry needling that I did before him is different than what he does, So so the ones I did before, it's nothing. Like you just like put needles in my neck, and it didn't do anything.
In your past, did you have chiropractic care?
Oh yeah. Yeah.
You did. So you had some manipulation of your neck.
Yes, I was going to chiropractor. They would just twist my neck 2-3 times a week. I would get like adjusted, they say. Yeah.
Was that, so did you get that prior to your symptoms starting?
No.
Only after?
Only after, yes.
Okay.
Yes.
Then when you saw me initially, were you having clicking, popping, grinding of your neck? Like it would make sounds?
Not the neck, but you said I had clicking here in my shoulders.
Okay.
Yes.
Okay.
Yeah.
Then did 2 years ago, up until the time I saw you, did you have neck pain or not too much?
Prior to the symptoms?
Yeah.
No, I've never had. No, I just woke up the one day with all the symptoms along with the neck pain. All came
on
like
both
at
sides,
the same time.
The neck pain?
No, just the right side right here.
Just on the right side. Then you said you're a full-time mom.
Yes.
Were you on your cell phone a lot?
Yeah, I spend quite some time on my laptop. Yeah, most of the
just
the day.
Communicating with
Communicating, yeah, and yeah.
So you started with me how long ago?
In June.
Okay, so June, now we're
4
in
months,
this.
yeah.
Just 4 months.
4 months, yes.
Okay, then you got prolotherapy.
Yeah.
Then you started working on your curve.
Yes.
And then today you're here for your fourth visit of prolo. So basically, you've been under care about 3 months.
Yes.
You know, three and a half months.
Yeah.
So how are you doing?
Oh, very good. I'm I would say 70 to 80% better.
Okay.
Yes.
And how's the high heart rate?
Oh, it's I haven't had any flare-ups since last June, since I first started. Yes. Yeah, I'm so happy about that because that used to scare me a lot. Yeah.
And then when did your vision, how's the vision doing, and when did it clear up?
It cleared up, I would say, after my second treatment. Okay. Yeah, after second treatment. Yeah, totally fine, 100%. I even went to a eye doctor to check up and everything's fine. Yeah.
Okay.
Yeah.
And you had a few other little symptoms. How are those doing, the other symptoms?
So the heart rate, blurry vision, and the off balance that used to be very bad. Now it's it's still there, but not every day. It would just hit me sometimes for a couple seconds, and then it will go away. Yeah, it's way better, way better. Before I wasn't I couldn't walk without holding on into something. If you want to go in the store, I have to push a cart, even though if I don't need anything, I have to hold on to the cart. Now I go in and out, and yeah.
How was hubby? Was he supportive of you guys coming down here?
So supportive. He wanted answers. He wanted me to get better because
so he's a believer
too. He works a lot. So if I'm down, I'm not doing good. The whole house is yeah. Yeah. He makes sure books all the tickets and the hotels for us. He takes off work just to come with me here, and we bring the kids too. Yeah.
Yeah, they're amazing.
Yes.
You got great kids.
Yes, thank you.
How'd you do it?
I did. As every mom, yeah.
Yeah, they're just turning out. They're such beautiful kids, real nice.
Thank you so much, yeah.
So you're pretty optimistic of getting all the way better?
Oh, yeah, of course. I mean, that's why we flew in from Louisiana yesterday, and then we're going back today, and then I'm going to come back for my 5th treatment, yeah.
What changes have you made since you've been coming here? What changes? What do you do different now that you didn't do before?
I changed my diet, to be honest. That's one of the things.
Yeah, explain.
I changed my diet. So all used to the American Standard Diet, as they say, I feel better when I cut back on the carbs. When I cut back on the carbs, I feel much better. Just stick with protein and vegetables. That really helped a lot, to be honest. So now I'm starting to get back into working out again, and getting fit.
Okay.
Yeah.
Do you use prism glasses, or what do you do?
No, not really. Okay. I don't need them, to be honest.
Okay.
Yeah.
Okay. Yeah. So you're trying to limit looking down at your cell phone?
Yes, I'm trying to limit. Yes, even being on my laptop or anything, I'm trying to limit all that. So I walk. I started to walk too. Take some walks, just to get a little bit active again.
Did you change your sleeping position?
I did, yes.
Okay, so explain that.
That's one of the things. So I used to sleep and then tuck my head into the pillow, and then you told me it would close like right here. That's what would cause the heart rate. So now I sleep. I bought a cervical pillow, which really helps, and then I just sleep like this. And then if I find myself going down, I just adjust my head again.
And then it was your vagus nerve was getting pinched, and that's what was causing the tachycardia.
Yes.
So it's slowly getting better.
Getting better. We're getting there. Yeah.
And then your instabilities are doing really good.
Very good.
The C1, C2 on the left still needs some work. So that's why we're going to do PRP today.
Yes.
Do you have any questions or anything?
No,
You're
really.
doing great.
Yes, thank you so much.
Like blurry vision and tachycardia, it's happening with a lot of people, so we just wanted you to share your story, so appreciate that.
It is related to the neck. If you have neck pain and neck problems, and you have like heart rate issues, it's from the neck, definitely 100%. I'm a proof of that. Yeah.
Thank you so much,
Yes,
Wafaa.
thank you, Dr. Hauser, for everything you do.